Good morning, everyone, and thank you for coming. Perhaps I could just say a couple of words to introduce the ACCJ and the overall purpose of the white paper. Next slide, please. The ACCJ was founded in 1948, and we're in our 65th year, have 1,000 company members and nearly 3,000 members in total. We had 3 chapters in Tokyo, Nagoya, and Osaka, so we have a nationwide perspective and operate through approximately 70 different committees based on sectors such as healthcare or cross-cutting issues such as rule of law and transparency or intellectual property. 50% of our membership is Japanese, and we focus in our efforts in 3 pillars of activity, including networking, programs where we have more than 500 events a year, and advocacy on a whole array of policy issues. Next slide, please. We try to capture what we're doing in all of our activities, these 3 pillars of activity this year, through a slogan in the traditional Japanese manner of a Yoji Jukugo called Kyoju Seicho, what we're translating as achieving growth together. And we really have 3 aspects of our endeavor around this theme of growth. It's not the 3 arrows that Prime Minister Abe has, but we hope that it's very much in sync with that. First and foremost, how to grow the Japanese economy, which we believe will be beneficial to our member companies as well. Secondly, how to grow our membership to live up to the promise of the ACCJ brand. And thirdly, and also very importantly, how to grow our individual members to create future leaders dedicated to the U.S.-Japan economic relationship. Next slide, please. So our healthcare paper focuses on some very basic issues related to the fact that Japan is an aging society. And that means increasing utilization of healthcare. We believe that worker productivity is absolutely essential, especially in that context and in a situation where the Japanese government is committed to growth of the economy. According to a 2011 survey, national survey that was conducted by the ACCJ, disability and absenteeism in the workplace account for a cost to the Japanese economy of nearly 3.3 trillion yen. And that does not even take account of the actual medical costs to treat the illnesses that cause that absenteeism. I would also mention that a shift to prevention and early detection of disease is necessary to increase the healthy life years of the population, to lower the economic burden of disease, and ultimately to support in the healthcare industry what is a major potential area of Japanese growth activity. Next slide. There's another factor or way to think about this, I think. Japan is noted for having one of the longest lifespans in the world on average. But if you look at this chart, you will also see that the average healthy lifespan is much shorter than the actual average lifespan. So that gap means that there are a number of years that people are living less than healthy lives, which of course, again, reduce the level of productivity, labor productivity, and also increase the medical expenses that are required to take care of that population. So again, if we move to a focus on early health care and prevention, we're going to increase labor productivity and shift the health care expenditure away from treatment to prevention, which is again a strong investment in growth. Finally, in the next slide, I would just like to introduce the white paper itself, which you all have sitting on your tables. We're very, very proud that this is a joint effort for the first time between the ACCJ and the European Business Council. We believe that by working together, we could formulate recommendations that really represent the best of global evidence and best practices from around the world. We've segmented the paper into 36 separate areas of healthcare topics, and within those 36 areas, a total of 150 recommendations, focused again on this idea of early detection, prevention, such that there will be more healthy working life and ultimately greater Japanese growth. With that introduction, I'm very, very happy to turn it over to my valued partner, Duco Delgorege from the European Business Council.
Thank you very much, Larry. Good evening, ladies and gentlemen. Ohayou gozaimasu. As introduced, I'm Duco Delgorege, Chairman of the European Business Council, or we say in short, EBC. Allow me to say a few words of introduction to the EBC. We are the trade policy arm of the 17 European national chambers of commerce and business associations in Japan. And we've been working to improve the trade and investment climate for European business in Japan for over 40 years now, since 1972. Now, the EBC currently works for around about 3,000 local European corporate and individual members, and we have around about 400 companies who are directly members of the EBC, working in 30 different sectoral committees. There are also some cross-cutting committees. And within that, medical equipment, healthcare is indeed one of our key priority sectors. And, you know, we're very happy to be working together with the ACCJ today in bringing forward this recommendations. The common bond among members of the EBC and ACCJ is the desire to improve the quality of healthcare in Japan and the well-being of the Japanese people. And of course, by that, we're saying together with the Japanese people, that is our common objective. Next slide, please. Globally and in Japan, as Larry also just mentioned, you know, people are living longer. But many of those years are increasingly spent under care for chronic and often preventable disease. A shift from a purely disease treatment paradigm to a prevention paradigm that focuses on prevention, screening, early detection, and early treatment of disease holds the promise of not only preventing disease and enhancing quality of life and worker productivity, but in yielding cost-effective interventions and better patient outcomes. Next slide, please. Now, many forms of chronic disease can be prevented or detected early, but health policies in Japan have traditionally focused on the treatment of the disease after it occurs or when it becomes critical, which can result in higher treatment costs. Here you can see the significant proportion of healthcare expenditure and deaths that are due to non-communicable diseases. Now, these are conditions that, if prevented or detected early, would pose a much lighter burden on the Japanese healthcare system, which is surely a benefit to society. And before me, Larry mentioned the cost to the economy, 3.3 trillion yen. I mean, we're talking about huge amounts of money. So there are huge benefits from an economic perspective, and of course, let's not forget, from a personal well-being perspective. Next slide, please. So finally, not only does preventative health and early detection of disease improve patient outcomes and create efficiencies in the healthcare system, It is an investment in the overall economic output and competitiveness of Japan. A more efficient allocation of healthcare resources that provides better patient outcomes boosts the economy in two important ways. It enhances labor productivity and it reduces waste. Our goal is to provide recommendations founded on evidence-based global best practices. And by global best practices, we refer to what we can see best around the world and, of course, in Japan. And surely it makes sense to take the best from around the world and to offer these as examples of the kinds of policies likely to yield significant positive potential impact. Thank you very much for your attention. I'd now like to hand over to Bill, who will take you to the next step of the conference. Thank you.